know very well, life, liberty, and the pursuit of happiness. Unfortunately, right now, I see that our government is trying to take them all three away. So I'm going to talk about them in backwards order. So first of all, I also want to dedicate this time and this particular presentation to all mothers, and especially the Queen Mother, the beautiful Queen of Peace. I'm a crazy Catholic, you could call me, but I'm glad to be so, and I'm glad I've had that opportunity to practice my rights to be a clinician that has ethics and values as a physician. So thank you to all those of you who are being mothers to your children. Let's start out with happiness, the rights to life, liberty, and the pursuit of happiness. I'm very happy to be in my profession. I love what I do. I'm one of those few rare people that love to go to work because I know that I'm called to stand and help with people with particular problems. But you know what I'm going to be unhappy about? Something I'm already having to deal with every day, which is I have to limit the number of government-paid patients that I take so that I can make ends meet. Do you hear what I'm saying? If I had to take every single patient from a government-paying source, I couldn't stay in business. So I have to have a payer mix in order to keep my doors open, to pay my staff, and to have the lights on. If we suddenly go to a completely government health care, I'm going to have more paperwork. I just know I just know. I'm going to have more paperwork, I'm going to be able to see less patients, and I'm going to get paid less. And that means I'm going to have to let a lot of my staff go and make a lot of harder decisions on how much I can actually be there and work. And you can see that I don't have as many gray hairs as some of your doctors. I'm just getting started. And I have to feed my family. I have 3 small children, and we're very fortunate to have my husband stay at home with the kids, but that's only possible because of the free country that we live in, where we have different organizations that make this healthcare run more smoothly. If all of healthcare were broke, I'd say about 70 to 80% of what we do is working right now. I know there has to be some reform in insurance and in the way that we do business and in the way the charges are made and so on and so forth. But we can't change that all in 1 month. We can't change that without going out and asking all of you what you want. We shouldn't be changing all of that without asking a few doctors. I think that those doctors have the pulse on what's going on right now, and they know what's broken, and I know there are certain things that need to be fixed. But it's going to make me really, really unhappy if I can't feed my family and stay in business. The other thing that's going to make me really, really unhappy, I want to tell you that most of the time when a patient needs a procedure right now in this country, we get them in there within about a week, maybe 2 weeks tops. Praise the Lord. And that's because we have competing healthcare systems. We have people that compete for your business. We have, down here we have a hospital that does some imaging. We have an imaging center. They compete for your business. And they want you to be there. They want you to get your procedure done. Praise the Lord. I'm going to be very unhappy to watch and wait as people suffer because there's going to be lines of people who need a procedure and cannot get it done if it's all run by the federal government. And we're going to have times when people are going to have that breast cancer and they can't get in for that surgery that they really need because that surgeon has a mile-long list of other people who they can't service until they finally get their payments. Does that make sense to anybody? So happiness. I want all of you to be happy with the healthcare system that you are using. And that's my goal every day, is to try to see people and to try to see them, to teach them with the truth in love, because I know only the truth in love, whether it's hard truth or not, is the only thing that can truly make them happy. Number 2, going in backwards order, liberty. We've already touched on what it means to have freedom. freedom in this country means that we can go out and we can choose which doctor we want to see. It means we can choose what kind of insurance company that we employ, and we can choose what options or not that we want to pay for. Joe was alluding to that if we have this government healthcare option, I know for a fact that they're going to want it to at some point be the only option. That's not liberty. That's not freedom. That's not choice. So I think about all the people who have been able to start their own business in this country, and all of the different businesses right now, the big businesses that, they employ thousands and thousands of people. What the government is trying to do is to employ thousands and thousands, maybe millions of people. If you look at Europe right now, and especially in England, that healthcare system in England employs the largest group of people in all of England. And so when they take something for a government vote, they have that entire backing. They can do anything that they want because they employ them all. Does that make sense? So unfortunately, if healthcare, which is a huge, big business, currently run by multiple different, segments, if that becomes completely under the government umbrella, then there won't be anything that they can't not pass. And finally, on life. So we've done life, liberty, pursuit of happiness, going in backwards order. We come to the issue of life. And I will admit, I'll be first to admit on the corner that I have definite religious background in how I support the right to life.